As I tell many people, I could write volumes about all the things I've seen in the 14 years that Dr. Mike has been in practice and since Dr. John joined us. I especially love the stories about the children, because if the children don't get adjusted and fixed, as I say it, as little children, then they're the ones that end up on all types of medications. So we are trying to prevent that if there is a conservative way. So I've seen children that have had ear infections that pediatricians have said they need tubes. Their parents have brought them here, we've adjusted them, their ears have cleared and they didn't have to have tubes. I've seen children with asthma come in, and when we've adjusted them, asthma is totally gone. My goddaughter at 3 years of age started having very high fever spikes, and they could not find a cause. They ran all kinds of tests and they all came back negative. And so Dr. Mike says, I know what's wrong, and he was exactly right. When he adjusted her cervicals, that was the end of any really high fever spikes, and she's now 16 years old, so never had those again. We see lots of athletes here. I've seen runners come in that were scheduled for a marathon and could barely walk with all the issues they were having, and the doctors picked them up, did some taping on them, and they were able to run their marathons and do very well. I remember specifically one that was registered for the New York Marathon and had some issues before then. We got him fixed and he flew to New York and ran the marathon. I've seen high school basketball players come in, you know, the day before the finals of the big tournament, and Dr. Mike adjusted their knees, or Dr. John taped them, and they were able to play in the tournament.